One of our heartfelt commitments here at Crossroads is to bring you updates on the work you've been supporting around the world through Crossroads Relief and Development. My guest today will be familiar to many of you. She's a Canadian hero in the fight for moms' lives in East Africa, and she's an Order of Canada recipient. Dr. Jean Chamberlain, thank you so much for joining us.
My pleasure. Great to be here.
We're so glad to have you back. You founded Save the Mothers, an organization that's fighting the incredibly high rate of maternal mortality in East Africa. Tell me a little bit about that work, just for people who haven't seen you before.
Well, really, it's an advocacy program, Gerald, helping to, as you say, improve maternal health. But it doesn't come from Westerners coming over and solving the problem. It comes from within the country. So we've been developing East African professionals who are leaders for maternal health in all different spheres of influence: politics, journalism, in the faith communities, in the educational system, who are speaking for safe motherhood and helping to educate their own communities and change the expectations for people that, mothers can be saved, babies can be saved in East Africa.
I love what you did because, a lot of people just want to throw money at the problem. Let's just improve clinics and hospitals, and that's part of the picture.
Yeah.
But if people's attitudes don't change toward the value of moms, about getting moms to the hospital, about giving them safe motherhood, not just having your baby in a field, like if some of those cultural things don't change, it's never going to change. And you're actually seeing incredible results now, aren't you?
One of the greatest gifts I could have had when I left Uganda earlier this year was to see the maternal mortality ratio, which was actually measured by the government, not by us. It decreased by 25% in the last 5 years. And that's really what it's all about, is actually seeing change that, again, comes from within and that is going to continue. So 25% less mothers that are dying as a result of unsafe motherhood. And we know it also increases the chances that those babies are going to survive as well, too. So that's the greatest news, yeah.
That's huge. That's literally moms' lives. Like that's what you can't measure in a sense, is how many moms are alive today because of that effort. I know it's not just you, but many people working. We've raised money for you here at Crossroads Relief and Development just in the last 2 years. Tell me what that money has done on the ground.
Well, the money from Crossroads has been so instrumental and helpful in really moving, particularly in the areas of the services and in the hospitals. Again, our program is primarily advocacy, but advocacy even within the healthcare facilities. How do we ensure that mothers come to a place that's safe and that they also are treated in a dignified way? If you come into a healthcare facility and there's 8 of us with our legs all up just delivering, I mean, it sounds terrible, but it's really the way it is in many places. So the Mother-Baby Friendly Hospital, which is part of the Save the Mothers program, has been working in now 10 Ugandan hospitals, and the monies from Crossroads has really been helpful to move that program along so that mothers are having a safe and a dignified delivery. And of course, Dr. Eve, who's been here on the show before, continues to be the leader of that program. And honestly, Cheryl, you see her walk into a hospital and deal with the midwives and the patients, and she just has this real touch of Christ, really, in the way that she works. And in addition to the work in Uganda, we are also working in Tanzania with the University of Calgary. Actually, the government of Canada has given some monies to the University of Calgary. But here's the wonderful thing, is that the monies from Crossroads has been able to allow us to start to build an operating room theater. And interestingly, the University of Calgary can't do that. Their monies are designated a certain thing. And so they are so excited about the money. I was just out in Calgary last week, and they are so excited about the contribution from Crossroads and from the generous donors from Crossroads, and it's making a huge difference. And I've been in this place before. It's called Mbarika. It's like way in a rural area, and just to see that they're actually going to have a place where mothers can be safely delivered, wow, that's amazing.
It's so good. We're running out of time, but I want to talk about this transition you're in right now, and that's, by the way, incredible news, and so good to hear. You have been living in Uganda 8 months of the year, and then coming back here 4 months working as an obstetrician. Now you're leaving Uganda. Tell me what's happening.
Yeah. So we've been in Uganda 12 years. My kids have grown up in Uganda. That's been our lives. But you know what, Cheryl? I think one of the most important things about leadership is giving the leadership role to the next person. And they don't need a Canadian there doing the things I was doing. Certainly at the beginning, I needed to be there, sort of person behind the scenes, pushing the program forward. But now the program's in place, and so it needs to be under the guidance and the direction of an East African. And so I just thank God for Dr. Miriam Mudabazi, who I've known for almost 12 years, who's taken over the role. She now lives in the house that I lived in. She drives the car that I used to drive. She's looking after our dog, and she has 3 cats, which is very important. But more importantly, and this is what I want people to understand, Dr. Miriam has other skills that I don't have. I am an advocate, I'm a speaker, I'm a push out there type of person. Dr. Miriam is the administrator who really is going to make sure that the program is being run in the way that it should be. And I think that is the key, is you've got an Indigenous leader who is very accountable. I am in touch with her every week already, even here from Canada. I'm going over twice a year, taking a vision trip with me in February. So anybody's interested in coming, we'd love for them to join us. So, I mean, that's what it's all about.
And you know what, it really speaks to your humility and your vision to do that. I know sometimes in the West we think we have to do it, but no, you're right, you have to raise up capacity in country. Thank you for doing that, and thank you for all you continue to do for moms around the world.
Well, and thank you to Crossroads. I mean, the exposure that you've given us, the videos that you've given us, we often use them in Uganda actually, and educate the Ugandans about their own country through the videos that Crossroads has done, so thank you.
It's our privilege, it really is. Well, we are going to introduce you to the new director of this important work in East Africa in just a moment. Stay tuned.